The Welsh Active Early Years project was a collaborative project supported by Welsh Gymnastics and Pacey Cymru, with Early Years Wales as the lead partner. Our original bid focused on Active Together Wales, a 4-week multi-skills movement and play-based bilingual activity programme, delivered directly to children and parents at community-based venues and outdoor spaces. It was to be delivered in 12 communities across Wales, with the project aiming to address the gap in services for parents and professional support. The development of resources would underpin the development of knowledge to advance physical literacy from birth to 5 years of age, and the aim of the project was based on the concept of a cradle-to-grave journey where the promotion of physical literacy is relevant throughout life and is as important to preschool children, the adult and the older adult population. The Active Together Wales project encouraged children and adults to start enjoying playing actively, enabling them to reap the benefits of a healthy lifestyle, with play being central to a child's physical, mental, social and emotional health. The activities supported whole body and brain development. We wanted to encourage a range of daily movements that were achievable at home that would support resilience and flexibility, contributing to both the child and adult's physical and emotional well-being. The sessions were held indoors and outdoors in community settings as well as public spaces, and each session was based on a well-known children's story that took each page of a book and brought it to life with activities that developed fundamental and formative skills. These were achieved through 3 different stages of activities that supported whole family learning, with ideas that transferred into the home using low-cost or no-cost items. By the summer of 2020, we realised how many first-time parents were attending the Active Together sessions with tiny babies, and that there was a need for a very different outlook to those that we had with our toddlers. We were still in and out of lockdown at this stage, so having identified this need, we introduced and created a series of 6 videos that were used alongside the delivery of a 6-week programme specifically targeting babies in their first year of development. Active Baby at Home was created. Using our early years expertise, it linked in with the importance of the first 1,000 days, the time when a child's body, brain and immune system grows and develops. This is significantly developed through movement play, which is key to all areas of baby development, including movement and motor skills. Our initial aim was also to deliver sessions to practitioners using the Play to Learn Plus programme. However, it became evident following early delivery that there were gaps in practitioners' learning and that there was a need for a bespoke training focusing on babies and children in the first 1,000 days for practitioners as well as parents. This led to the development of Active Baby and Due training. This examines in depth the physical development and physical literacy of babies and young children in that period of development. It supports analysis of why movement and physical activity matter, with reference to elements that babies and young children need to create a secure sense of themselves in their bodies, in their own unique relationships to the environment and the significant adults and materials within the environment. Although the pandemic affected delivery for the first part of the project, practitioner sessions will continue to run. We ran them virtually throughout lockdown, training 302 practitioners in total, with each setting receiving one of our Active Baby and Due packs. The pack was designed under different stages of early development: 3 to 6, 6 to 12, 12 to 18 and 18 to 24 months, plus the 2 to 3 years of age. The activities and supporting information aim to provide the practitioners with ideas and information on the development of whole body movement and the integration of the senses. What followed and happened over 3 years surpassed our initial aims and objectives, and over the duration of the project, Welsh Active Early Years covered all 22 local authorities in Wales. The demographic reach included parents from areas of social deprivation, rural areas and urban areas in Wales. This resulted in a suite of resources being produced to support all the work. We ran Active Baby and Due and Active Toddler sessions aimed at the first 1,000 days of life, our Play, Move, Thrive training, which was aimed at child's physical development from the age of 3, and then Active Baby at Home, which became the Train the Trainer model to support practitioners to support parents with those babies aged 0 to 8 months. This comprehensive resource library to this day still supports the holistic child development based approach to the physical activity and the early stages of the physical literacy journey from birth to 5. It provides information and practical support for practitioners, parents and caregivers. During this time, we also worked with dads groups on Saturdays, delivered flyer kite park events aimed at keeping momentum for physical activity going, and we linked with the health board delivering packs to neonatal families on the wards. These provided ideas and activities that supported the neonates as they became stronger and aimed to give parents confidence about the benefits of playful movement. Physical activity data we captured using the tools were the International Physical Activity Questionnaire, as known as the IPAC, the Mental Wellbeing Warwick-Edinburgh Wellbeing Scale for the adults, and the Leuven Wellbeing and Involvement Scales for the young children. The intended outcome evaluation identified on a short term that parents had increased in physical play between the adult and the child. They'd increased physical activity in day-to-day living, for example, walking to local places and using parks, and using a car less for short journeys. There was also improved short-term mental well-being. It also improved the knowledge of the local area and use of local community facilities for physical activity. Parents felt it increased social interaction for the young children alongside an increase in time spent with other parents and adults. And adults also reported an increased knowledge about health and well-being. On the longer term, we saw an increase in the physical activity levels among participants that had continued with the parent and child playing and being physically active together on a regular basis. An increase in well-being in participants, a reduction in childhood obesity, and a decrease in environmental impact by fewer journeys as participants were more likely to walk on shorter journeys. Accompanying our offers, Early Years Wales has developed a range of supporting resources on our website as a signpost for parents and practitioners. There is also a suite of professional development videos to accompany the training noted earlier, and these videos are supplementary to the training and provide tools for practitioners to access under permission to work with their parents in an informative way to support knowledge sharing. During the live project phase, additional parent supporting materials were also released periodically to promote activity in line with events and seasonal celebrations, and we continue to engage with parents who are linked to the project. The outputs I've talked about have gone on to become highly regarded resources and have sparked interest from a wide range of stakeholders, including childcare settings, sports national governing bodies, local authorities, health boards and other stakeholders. We have evidence to show that professional development through these programmes is still needed in a range of contexts, including childcare, education and public health. Our programmes also suggest that the impact of professional development is that practitioners create more opportunities to promote children's physical activity and plan more for children's physical development. And furthermore, our parent-focused programmes demonstrate that empowering parents with the understanding of why physical activity is important for wider child development results in more embedded movement opportunities in a child's day. At the conclusion of the project, Early Years Wales has developed a portfolio of high-quality physical activity training that promotes physical literacy and positive well-being. This is also linking to address the mental health concerns in a preventative way, and it addresses the skills and knowledge gap for practitioners and wider professionals. The project has gone on to complement the Active Together programme and Play to Learn Plus initially developed. And with only 12 associate facilitators and a team of 3 internal support staff, the project achieved participation numbers reaching 315 parents and carers, 330 children being encouraged to be physically active with their parent. Active Baby at Home recruited 310 participants into the project and provided a much-needed social connection for parents with young children. We ran 80 follow-on sessions. We ran 211 Active Together and Active Baby sessions. and we ran Active Together and Active Together baby groups across 22 counties. The Active Baby at Home Train the Trainer has, to the end of the project, trained 71 practitioners, and the Active Baby at Home Train the Trainer programme has delivered 6 external projects. So some of our partners that we've worked with include Bookstart, Homestart, Health Visitors Across Wales, the UHB Neonatal Hospitals, Cwm Taff and Betsy Cadwaladr, Flying Start, the Sports Development Officers, Sport, RCT, Women Connect First, Run for Wales and Dads Can Cymru. And we would like to thank each and every one of these for making this project a success. If you have any questions, now is the time. Thank you.